Psychiatry and the director of the Alzheimer's Disease Research Center at the Icahn School of Medicine at Mount Sinai in New York City. Dr. Sano is a neuropsychologist by training and an award-winning clinical trialist focusing on cognitive impairment in aging, Alzheimer's disease, and related dementias. Her work has focused on understanding the cognitive consequences of disease and on discovery of interventions to improve cognition. She's also made major contributions to the understanding of the behavioral and psychiatric conditions that co-occur with cognitive impairment and dementia, and designing trials to improve these conditions. She has pioneered in-home assessments using technologies which permit large-scale prevention trials to occur remotely, increasing the opportunity for research participation across populations. With colleagues at Mount Sinai, she contributed to the establishment of the first memory clinic in a public hospital in Mumbai, India. Her work has also assessed the economic consequences of cognitive and psychiatric symptoms in Alzheimer's disease and related dementia, demonstrating the cost of these diseases in terms of occupational loss and direct and indirect medical care. Dr. Sano has authored over 300 peer-reviewed publications and mentored more than 100 young scientists and clinicians. She was an inaugural member of the Alzheimer's Association's Medical and Scientific Advisory Group and has held leadership roles in national and international organizations committed to the care of older persons with dementia. She's also dedicated to creating the next generation of scientists and clinicians to carry our field forward. So please join me in congratulating Dr. Mary Sano.
Obviously, I want to begin by thanking the Alzheimer's Association for this award. I've really had the honor of working with the Alzheimer's Association for many years, and I so appreciate their advocacy for patients and for families. And equally important, their strong support of research. It is that incredible contribution that allows us to do as much as we can. I want to say thanks to patients and their families who give generously of their time and of their concern to join our research projects. We really could not move forward without their commitment. I also want to thank my family who fill a row here. They came from far to enjoy this great moment. So thank you. Incredibly fortunate to have seen real progress in Alzheimer's disease, raised awareness, new treatments, better ways to diagnose. While there can be concern, and we all have it, for what we can do next, we have to realize we have done so much and we can keep going forward. And so I want to join the association and all our scientists who say, let's continue this. Let's share our advocacy with those in charge. Tell them that we can't go forward unless they support us and continue. Finally, I want to comment that I have been incredibly lucky. I have been able to work at something that I love so much, and I have been supported by a lifetime of friends and colleagues. And I want to say to those of you who are either at the beginning or the middle of your career, I hope you really have the experience and joy and satisfaction of doing something important, something that you love, and something that is worth doing for those people who really need us, for our patients and their families. Thank you very much.